And you want me to take roll call for this?
Sure.
Okay, Secretary Mahania?
Yes.
Bella?
Yes.
Nancy?
Yes.
Dana?
Yes.
Just checking in to see if Dimitri showed.
I don't see him.
Okay, nope, fine. Thank you, everyone.
Great. Thank you. Motion carries. The next item on the agenda is the financial update, and I think it's going to be presented by Carrie, Edith, Rakita, and Josh.
That's right. Thank you, Bella. I can start us off. Good afternoon, Mr. Secretary and members of the Administration and Finance Subcommittee. The purpose today is to review this presentation, which contains our updated fiscal year 26 financial projections, as well as our fiscal year 27 maintenance recommendation. This has been shared with staff at the Administration and Finance to consider for inclusion in the governor's budget, which I understand is going to be released very soon. And these projections have also been reviewed with Bella and shared with the full subcommittee. So I think it goes without saying, now is a time of great uncertainty, which makes this budget process especially complex. And I would just like to take a minute to thank all of the staff that worked on this. It's been very challenging. I think, as everyone knows, the Health Connector is predominantly funded by the Commonwealth Care Trust Fund, or the CCTF. This fund is managed by our A&F colleagues. The CCTF funds 100% of the Health Connector's programmatic costs and about 35% of our operating or administrative costs. This is down from about 40% in prior years. Our programmatic costs are primarily state subsidies in the form of state premium wrap, as well as cost sharing reductions. And the majority of our administrative costs are for our vendors that perform services on our behalf for our members. For fiscal year 2026, we are projecting that we will need about $475 million gross in total from the CCTF for Health Connector program costs and a portion of our operating expenses. Edith will provide some additional details, but this is higher than what was shared at the last subcommittee meeting back in May. And this is due to the extension of the Connector Care Expansion Pilot Program through calendar year 2026. For fiscal year 2027, we are projecting that we will need about $561 million gross in total from the CCTF. And the increase compared to fiscal year 26 is primarily due to the expiration of the enhanced federal tax credits that expired that will expire at the end, have expired at the end of 2025. With respect to our operating budget, projections are slightly unfavorable compared to the board-approved budget that we reviewed and that was voted on back in June. The current unfavorable variance is related to one of our significant fixed price contracts. As we are proceeding through implementation, the operations phase was delayed by just a few months. And at this point, we are conservatively assuming that we will make up these payments in fiscal year 2026. However, this may just be a timing issue, and those payments may shift into 27. And as we learn more over the coming weeks, we will adjust the budget accordingly. The fiscal year 27 recommendation reflects a return to more stable operations as we anticipate all of the implementations that we are currently going through will be complete. And we are estimating that year-end reserves at the end of 27 will be equivalent to about 6 months worth of operating expenses. So I will pause there. And if there's no questions or comments, I am happy to turn it over to Edith to start discussion on fiscal year 26.
I'm not quite sure I understand the 3 million variance from the for the timing.
Yeah, so it was the contact center vendor, and there is a period of operations and maintenance that's worth 12 months. That was supposed to start in July of 2025, but it ended up being pushed back until October of 2025, so 3 months. So because it's a fixed price contract, there's a certain amount that we would expect to pay out, that we expected to pay out in fiscal year 26. But because of that delay, Nancy, that 3 months worth, we're not really we think that might occur in 27, but we're not quite sure. So we've conservatively kept this in FY 26. But we are, of course, monitoring, and we will be adjusting that if need be.
Okay, I understand now. Thank you.
Thank you, Nancy, and sorry, I could have been a little more clear.
No, that makes sense.
Anything else?
I could have been a little more sharp, so.
No, it's me. Thank you, Nancy. If nothing else, I will pass it over to Edith.
So good afternoon, everyone. As you're aware, there are major changes in 2026. The enhanced federal premium tax credits, also known as EPTC, expired at the end of 2025, which increases state premium RAP subsidies significantly. Enrollees in plan types 1 and 3D are no longer eligible for federal premium tax credits, resulting in their exclusion from the Connector Care program. The pilot was extended 1 more year for people with income between 300% and 400% of FPL, and 2026 rate increases were significantly higher than what we've seen over the past years. Also included in the FY26 programmatic budget, there is premium smoothing for core Connector Care enrollees, which continues with similar parameters as plan year 2025. Enrollee contributions for the lowest cost silver plans increased by around 3.9%, and carriers continue to include a load in their rates for the standard silver plan offered to individual to offset the loss of funding for federal cost sharing reductions. So what we call usually silver loading or CSR loaded rates. Are there any questions?
I do, but and maybe we could wait till the membership file slide, but I just want to, I guess there was some confusion in my mind. So just to confirm, 3D, which is above 400, those enrollees are no longer eligible for APTC because of the American Rescue Plan has ended.
Mhm.
And 3C, which is 300 to 400, that we're even though the expanded subsidies has gone away, the state is picking up the difference between now and June 30th. Is that right?
So there's still there is no enhanced APTC anymore, but there's
Right.
APTC for 3C.
Yes.
And yeah, it's expanded until the end of 2026.
And okay,
December 31st.
so until December 31st of this year, they're still going to experience the expanded premium tax subsidies, the 300 to 400, because the state's going to pay the delta, right?
Right. It's like before we had, APTC only, so they were receiving
Yeah.
only the APTC, the regular APTC.
Yes.
So now this population is receiving the regular APTC, but in addition to it, the state is providing some premium subsidies.
Okay, so then in 1/1/2027, that 300 to 400 population will experience some sort of premium shock because that expanded piece is going to go away.
That's right.
Okay.
And Bella, I would just add that that is current law now. So that is
Yeah.
what we're assuming here, but the budget process is just getting set in motion. But as you know, everything we've assumed here is just what the current law says, and the current law says it's just through end of 2026.
Okay.
And to
Because
your-
Audrey, I think you had mentioned and you and I talked about this, we always thought it made more sense once the ACA happened to expand Connector Care to 400.
Right. We never really trued those up. So there was always this gap until we did the pilot. There was this strange gap between 300 and 400% where you could get APTC under the Affordable Care Act, but you couldn't get Connector Care.
So it's like a cliff, really.
Exactly. Right.
And
or it was sort of, yes, this like stepwise kind of thing that was going on where some people were getting state and federal, some people were getting federal, and
Yes.
some people were getting nothing.
Yeah,
So now we are aligned, and obviously we're
we're
incredibly
aligned though, only for this year.
only for this year unless something happens through the state budget process.
Okay,
But yes, that's right. That's right.
thank you.
So if there are no other questions, we can go to the next slides. And maybe even going to the next slide so we can see the numbers in the exhibit. So FY 2026 gross costs are estimated at 474.9 million, which is 42 million higher than the projections presented at the last ENF subcommittee meeting in May. The cost after federal financial participation increased by 17.5 million. And the main contributor to the increase is the extension of the Connected Care pilot into plan year 2026 for the 300 to 400% FPL population. And then there is federal favorable CSR reconciliation that is partially offsetting some of that increase in cost. Any questions?
When I jumped in a few minutes late, I was running behind.
Hi, Dimitri. Thanks for joining.
And then Edith, I just advanced to the
Yeah.
cost slide. I don't.
Yeah, so if there is no question on those cost exhibit, we can go to the membership slide. Yeah.
Actually, one more question. Do you ever look at like program costs on a PMPM basis?
Yes,
Okay. Then that's maybe something we can look at together offline.
sure.
Okay.
Okay, so for the
Previously, a PMPM slide that we used to look at way back when.
maybe a long time ago we presented it, but if so, that's a really long time ago. I know there is a PMPM on the admin budget sometimes that is presented. I'm not sure if that's the one you're referring to.
Okay, probably.
Yeah,
I just know
Dimitri.
we used to
Oh,
look at.
I'm sorry.
Go ahead. I'm sorry, Carrie.
We used to share a PMPM slide, and I'm actually glad that you mentioned that. We've been doing a little bit of research, and we've shared some of this with Bella, looking at our per member per month costs for our operating budget and trying as best we can to compare that to other state-based marketplaces. And we're in the process. We have all of the amounts, but we just want to go back and confirm with the other SBEs. We had very productive meetings with them. We actually reviewed this presentation this morning internally, and we're more than happy to share that once it's finalized and once we confirm. But it's really fascinating, and I'd like to thank Asaf for all the work that he's done on that. So more than happy to share that with the subcommittee in the coming weeks.
Thank you.
Okay, so on the enrollment side, member months are projected to be 0.9% higher than estimated for the board of director meetings last July. And this variance is due to core Connected Care. Any questions on that?
So I guess and I might be repeating stuff that everyone already knows, but I just want to look at the slide. So on December 2025, we have 252,000 Connector Care folks, and then we're projecting in January 2026, 221,000, and the drop there is mainly because of Plan Type 1.
That's right.
And the Connector Care expansion we have at 62,000, but in January 26 at 47. So I guess why the drop there if we're continuing the program?
So the 47,000 is plan type 3C. And
Oh,
62 included 3D, but now 3D has moved to unsubsidized.
yeah,
Some of them have terminated, but the major part of 3D is in unsubsidized.
okay. I get it. Okay, so that's the 400, above 400. The drop between 62 and 47 is mostly above 400.
Mhm.
Okay. Thank you.
Good afternoon, everyone. Our fiscal year 26 financial projections are slightly less favorable compared to what the Board of Directors approved in June. This variance is driven by several operational transitions currently underway. We successfully transitioned to a new contact center vendor, AHS, with the support from a prior vendor, Accenture, whose contract ended in January of 2026. At the same time, we're in the midst of transitioning to a new enrollment premium billing and fulfillment vendor. To ensure continuity and minimize risk, we are running parallel operations for a few months, which has a temporary cost impact. The next slide shows a breakdown of these expenses in more detail. This table compares the current fiscal year 26 projections to the one approved in June by the Board of Directors. At the top of the table, you can see the total enrollment in member months. Due to the factors Edith mentioned earlier, total member months are projected to decrease by approximately 70,000. Despite the decrease in enrollment, we are projecting a 2.5 million increase in revenue. This is primarily driven by the increase in career administrative fees, which can be attributed to the premium increase amounts for calendar year 2026. The total expenses have increased by 4.8 million. The primary drivers for that is the contact center and enrollment premium billing process, which includes running concurrent vendor-based operations for our fulfillment and enrollment and premium billing vendor. The variance is currently unfavorable, but we are monitoring this and we will update the projections accordingly. The increase is partially offset by a 0.6 million reduction in our consultant cost and salaries and employee benefits. Overall, the net position was reduced by 3.1 million. Our year-end reserves are estimated at 55 million, which is sufficient to cover approximately 6 months of operating expenses. Before we move on to fiscal year 27, I'm happy to take any questions.
Yeah, could you remind me how the carrier administrative fees work? And why if we have a decline in member months, those are going up?
I'm
Is
going
that
to
just
actually
the
have
premiums
Edith
are
take
going up?
this because it has a premium impact in terms of how the premiums have increased. So the percentage of the administrative fees that we have
Yeah,
are based on those premiums is why we see an increase in the revenue, even though the enrollment numbers have reduced.
yeah.
But Edith, if there's anything to add to that, please feel free in terms of the percentages of premium increase.
You guys can clarify for me because in years past when we had discussed this and we talked about PMPM and member month costs and the whole things that we were doing around technology to improve the quality of service that we were providing to our members. The game plan was that we were laying out the roadmap so that overall we were going to be able to reduce our costs, even if our membership was going up, and that we weren't going to see a linear movement of costs as it relates to members. Now we're seeing a slight decrease in membership, but the cost is still sort of like growing. So um, can you help me understand why we're seeing that increase as opposed to what was expected in the past was sort of like the use of technology and overall cost per membership should be going down and not what we actually seeing in reality, which is the opposite.
So
So-
Dimitri, oh, I'm sorry,
Yeah,
Rakita.
go ahead, Carrie.
So I would say part of the answer is for fiscal year 26, we have pretty significant one-time costs because we are currently, and we're about done implementing contact center, but we're still implementing the enrollment and premium billing system, as well as a new fulfillment vendor. So our costs this year are certainly impacted by that. You'll see for 27 that the costs are significantly decreasing. I think without switching slides, I think it's around 18 million or something like that. So this year we are seeing quite a number of, one-time costs. I would say that the other thing that we're still trying to fully appreciate and understand as we complete this transition is a lot of our new major contracts now are fixed price as opposed to per member per month. So with all of our, the membership changes and whatnot that we're seeing now, that's one of the reasons why we started on this PMPM exercise, but just to get an appreciation of, historically where we've been and where we think we're going in the future. Does that help? And I'll stop. I don't know if anyone has anything else they'd like to add.
I would just thank you, Carrie, for that, and Dimitri for the great question. And I would just reinforce that is the direction we are going. But as Carrie noted, right now we are in this period where we have overlapping contracts as a result of efforts we're making to better leverage technology and particularly strong vendors that are particularly suited for our operations, for our services, and where we're trying to take things. So that does continue to be the goal. And I do think Carrie's, the deck she referred to, where we've done some cross-state comparisons is a helpful look here. Unfortunately, it just sort of can't be linear in the sense that when we're needing to swap out vendors, there are these one-time costs. So that's part of what you're seeing here. But the overall arc and direction of intention here is certainly aligned with what you have indicated.
Anything else on 26 before we move to 27? Okay, hearing none, I will pass it back to Edith.
So FY27 includes some additional significant changes. The most important ones are the loss of eligibility to federal premium tax credits for thousands of non-citizens effective on January 1st, 2027, and a shortened enrollment period that will end on December 31st, 2026. In addition, under current law, the Connect to Care expansion pilot is scheduled to expire at the end of 2026, as we talked about a few minutes ago. So this budget assumed that premium smoothing for Connect to Care, core Connect to Care, will continue for plan year 2027 with the same parameters as the one currently in place for plan year 2026, and that CSR loaded rates will continue also for plan year 2027. Enrollee contributions for the lowest cost silver plans are projected to increase around 3.5% on average. Any questions? If not, we can move to the next slides. So FY 2027 gross costs are estimated at $561.5 million, which is $86.7 million higher than what is projected for FY 26. The net cost net of federal financial participations are $325.8 million, which is $44.2 million higher than FY 26. There are a lot of moving pieces affecting the cost changes between FY 26 and 27. The major contributors to the increase are the expiration of EPTC, lower CSR reconciliation, and also the rate increases. The loss of thousands of non-citizen and the scheduled expiration of the pilot are contributing to partially offset those increases. Any questions?
I guess just to confirm, So the fiscal year 27 column reflects January, it reflects 6 months of expanded subsidies for the 300 to 400% of the federal poverty level.
Right, yeah.
Okay.
Yeah.
And then in January of 2027, those expanded subsidies funded by the state go away.
That's right. Yeah.
Okay.
So,
And that is why we see higher program costs, because we weren't funding those expanded subsidies in fiscal year 26.
right. So, for FY27, we have a full year of just regular EPTC, like no more EPTC, no more enhanced. So we're comparing basically for the first 6 months, July to December 2025 to July to December 2026. So, that's a big chunk of the increase.
Okay.
Yeah.
And then the other chunk is the premium increase
Yes.
in general.
Yeah, that has a big impact on both, like CSR state subsidies, like CSR subsidies and state premium subsidies.
Right.
So if we weren't losing the enhanced tax credits, how much would we be drawing?
So for 2026, the impact is about 250 million
Yep.
between EPTC and the regular
Yep.
EPTC. Yeah. It's a lot of money.
Yeah.
Yeah.
And Nancy, this is not the question you asked, but we estimated the total value of EPTC at the state as
Yeah.
at about 425. So
Yeah.
the other share of the 425, that's not the 250, was direct impact to people.
Yeah, that was what I was
Staggering.
trying to figure out how to ask. So
Yeah.
thank you for
Yeah.
answering what
Wait, could
I
you say
wanted to
that?
ask, but couldn't quite figure out how to ask.
Yeah,
Could you say
So-
that again, Audrey?
sure. So
Yeah.
the total value of EPTC coming into the state that was above the baseline of APTC
Yes.
was about $425 million.
Right. So that's all gone.
That's right. So we're back down to, there's no more 425 million. And so 250 million of that was essentially absorbed by the inherent design of the connector care program. And the other share of that was people who were getting, directly experiencing the premium increase that was just a direct result of EPTC expiration. So think about someone who was the cleanest example would be somebody over 500% of the federal
Okay.
level who
Now
might
they're
have
paying
tax credit. Yep.
out of it, or they're dropping coverage.
Yep.
Or they're okay. So of the 425, the state kicks in 250, and the rest is being either paid for by the enrollee, or they're dropping out.
Could be. Yep.
Yeah. I mean, we don't know.
We don't know. Yeah, the 425 was just what we could see in, I don't want to butcher any of Edith's wonderful actuarial analysis from last year, but what we could see on an annual basis was coming into the state. So the decisions people are now making in response to those changes, that picture is still coming into focus.
And how much of that 250 is 3C?
I will have to look at it. I'm not, I don't have that
Okay.
off the top of my head.
I mean, these are all, I'm just asking these questions because I'm just wondering, like, how do we continue this for next year, right? Like, that would be the hope, but it's gonna be a lot of money. And for the 3C population, 300 to 400.
Should I advance to the next slide?
Yes.
Net costs.
So, and then we can move to the enrollment slide. So here again, we see a decrease in enrollment in January 2027, and that's mostly because we're expecting to lose thousands of non-citizen according to current law for 2027. So overall, member months are projected to be 6% lower as a result of that.
Could you flip back to the other membership slide? Yeah. So between December 25 and January 26, where we are now, who are those people that we're dropping? The 252 versus the 221.
So those are the plan type 1 people.
Oh, and then okay, those are the plan type 1, and then from December 26 to January 27, we're losing an additional group of people, not necessarily plan type 1, but non-citizens.
Yeah, so plan type 1 are gone. They're not all gone. Some of them are in unsubsidized.
Right.
And some people that were in plan type 1 in December have moved to another plan type because their income has changed. But there is, no plan type 1 in 2026. So the people that are leaving on 1/1/27 are, in other plan type.
I gotcha.
Based on their immigration status.
Yes, and just a fine point on that, that's all out of the so-called One Big Beautiful Bill Act, and it kind of comes in waves where first the lawfully present under the poverty level population lost PTC on January 1st, 26, and then, as Edith noted, for 27, there's a different kind of category or class of lawfully present immigrants that will also lose PTC, but they're sort of sprinkled throughout the PTC income eligibility.
I didn't know that. So,
Yep.
and what is the reasoning, I don't know, of doing the lowest income first and then the highest income second?
I am very hesitant to get into the
Okay, fine. Yeah.
But I mean, I think it's like, they don't want very low income immigrants. They're trying to make a hostile
Yes.
environment.
Yeah. Okay.
Is my guess.
Anything else on programmatic or enrollment? And if not, I will turn it over to Josh to walk through the fiscal year 27 operating budget recommendation.
Thank you, Carrie, and good afternoon, everyone. So looking at fiscal year 27, our financial projections assume a more stable vendor operations as the implementations that are going on right now are expected to be completed by the end of this fiscal year 26. We propose keeping the admin draw for, or the CCTF admin draw for fiscal year 27 at 35 million, which will keep our fiscal year end reserves at a healthy level. We can get on to the next slide with a breakdown of these projections. So this table compares the numbers that Rakita had just gone over for fiscal year 26 with what we're projecting for fiscal year 27. At the top, we can see the total enrollment in member months, which is projected to go down since the Connected Care expansion pilot is currently set to expire at the end of calendar year 2026. And we expect this to have a impact carrier administrative fees and reduce them by nearly 7 million. Moving on to the expenses, we project that these are going to be more than $18 million less than fiscal year 26, mainly because of the contact center and enrollment and premium processing implementations. for the EPB implementation that ends in the end of fiscal year 26, this is going to have an impact on the expenses and reduce them by 8 million. And then the transition and end of the concurrent operations for the contact center in fiscal year 26 will decrease costs by another 8 million in fiscal year 27. And then for consulting and professional support, 2 million in resources that were brought on for those implementations aren't going to be needed in 26, and that'll decrease costs as well. So looking at the bottom line compared to fiscal year 26, our net position is going to increase by 12 million, and this is going to result in year-end reserves of 52 million, which is enough to comfortably cover 6 months of operating expenses.
Have we thought about doing like, and maybe it's a lot of assumptions, but fiscal year 2028 admin budget, just because, we had a negative last year, we're having negative this year. We want to make sure we have 6 months in operating expenses in our reserves. Like, what's our trajectory going to look like?
Thank you for the question, Bella. We do. Our model goes out, I believe it's 5 years. So we do have preliminary projections. But how precise those would be at the
Yeah, I know.
moment is anybody's guess. I mean, like I said, we've transitioned a lot of our major contracts to fixed price. We do anticipate, as Josh indicated, a return to more stable operations. So, happy when we meet with you next, if you'd like to get, an early preview, understanding that things could change. But yeah, happy to share that with you.
Yep.
And Bella, I would just note, we've discussed this at the strategic meeting in November, and then I know we've had some other conversations about our interest in building in more scenario planning to the way we think about, particularly for some of those out years, and appreciating that we really are in a more uncertain terrain than the connector has historically been in from a programmatic and otherwise perspective. So looking forward to filling you in on some of the thinking we're doing in that regard as well.
Great. Thank you.
Any other questions on 27? And we will, our next subcommittee meeting will be in May, prior to the board vote in June. So we will see you then and bring refreshed projections for your review. If you have questions or comments or need anything in the meantime, please do let us know.
Is that where we have to finalize the budget for next year in May, or at the next connector board meeting after our May finance meeting?
Yes, so we will share fiscal year, updated 26, of course, but we'll share with you what we will be planning. We will share with you in May what we are planning to bring to the board in June for a vote. So if nothing else on 27, just lastly, happy to report that we have another clean audit for fiscal year 25. No material weaknesses or significant deficiencies were identified. We'd like to thank our auditors. They are here on this call, and they will be, I believe they have a short presentation for you on the final audit, and then they're here to answer any questions that anyone may have. So I believe that's the last agenda item. So if nothing else for this item, let me stop sharing. I think we can proceed to item number 3, and it's just a reminder, the only Health Connector people that should remain on the call are Audrey, Kathy, Nuri, and Akash, and the rest of us should drop.
Thank you, Carrie and team.
Thank you all. Have a
Thank
wonderful
you.
afternoon. Thank you.
Thank you.
Thank you.
Thank you.
Just checking. Okay, wonderful. Bella, I defer to any commentary or teeing up you may want to do. I had shared a memo around with the subcommittee just regarding a potential COLA for Health Connector staff, which we often cover during this annual agenda item. It's not a formal vote, but something I'm looking to ensure alignment and support on if we were to proceed. But Bella would defer to you on any way you might want to tee that up.
Sure. I mean, has everyone had a chance to read or review the memo that Audrey sent around on COLA increase? Which I think just to confirm, Audrey, that it seems like the overall increase. Can you just confirm what the overall increase would be on average?
Yes. So the proposal is to shift to a flat dollar amount as opposed to doing a percentage. And the spirit of this is really just intended to be less regressive, particularly for some of our lower paid staff. So the proposal for consideration is a $5,000 flat dollar amount. We kind of approximated this looking particularly at a peer quasi-independent agency, the Health Policy Commission, that we sometimes look to as sort of a comparable. And so that allows, like thinking about what CPI was for 2025, which was 2.6%, that allows for folks who are lower paid, kind of on the lower two quartiles of the salary spectrum, to get something that's a bit higher than that, whereas folks higher up on the income scale will get something a little bit below that. So I can certainly follow up with more specifics just on that range. I would also just note, as noted in the memo, it would be sort of part of the proposal would be to exclude members of our senior leadership team, really just trying to be kind of spiritually in line with a decision made by the executive branch last year about managers foregoing COLAs just in light of the sort of fiscal picture. So that would be kind of a particular detail for this group's consideration as well.
Any questions or discussion?
Yeah, I had a couple of questions. In years past, we have looked at the situation with COLA, and I know from this committee, we have historically voted and support increases that were above COLA, with the understanding that there was a certain amount of stratification that would be taking place in terms of lower tiers employees versus the higher tier management type of employees. In reading the memo, what came across to me was that we still don't have parity as it relates to the lower tiers folks and other quasi agencies within the Commonwealth. Could you shed some light for me, perhaps, from a historical perspective? I know my tenure in serving on this board has literally been about 10 years. So could you shed some light for me from a historical perspective in terms of how have we, from a big picture perspective, how have we applied the sort of like above COLA that we have historically approved for staff? And if we were to jump ahead and do this flat, non-regressive 5K across the board approach, would that bring our folks more in line? And why weren't they being brought online based on all the steps that we were taking into place to try to adjudicate what we felt was lack of parity between them and other quasi?
Yeah, so great question. I would say, I think, and I can really only speak to the last few years having been in this seat, the way we have dealt with trying to make sure we're not inadvertently widening the gap between the lowest and highest paid staff has been many years, not all years. Our COLA has been up to a certain income amount. So it might be, in a given year, 4% or 6% on income up to $125,000 or something to that effect. So it is concentrating it a bit more at the lower levels. So I think we've tried in different ways to do that. But we're drawn to the kind of moving away entirely from a percentage wholesale, just because it is more of kind of a linear way of, the $5,000 means more to somebody earning $70,000 a year in a direct correlation all the way up the income scale to others. And again, knowing that we've got a peer quasi who has done this, and I believe for several years. I know they just implemented this in December, but I believe they've done it for several years, and it does seem like it's helping them hold down that potential for an inadvertent widening, which I know, and it sounds like you share an interest in making sure we're guarding against. So it's just kind of a cleaner way to get to that same endpoint that I think we were attempting with some kind of clunkier percentages, but it's cut off at this income level or that income level.
Audrey, it sounded from the memo as if HPC was doing the flat salary adjustment, but then was doing a bonus too. Is that right?
That's correct.
So, and that was for everyone in the agency, so it doesn't, so it recognizes everyone, but it just doesn't get built into the base. Did you all think about that?
We did not think about that for this year. We did a very small bonus at the end of 2025 that was 1,000.
Right.
We are interested as a leadership team in moving to a model from a performance evaluation perspective to do some kinds of merit-based bonuses in the future that reward extraordinary performance for all sorts of reasons that I think are self-evident. But we need a little bit more maturation in our performance review process, I think, to feel ready to do that. That could potentially be at the end of this year if we feel we've made enough strides and it's enough of an entrenched, mature process. But for this particular, we were primarily focused here on an adjustment that would account for cost of living increases as opposed to kind of a more bonus or merit-based approach, but would like to be able to consider that for the future and would love to think with this subcommittee about best practices there.
And how many people are on the senior leadership team, so wouldn't get anything under this proposal?
I should know this number off the top of my head, but there's about 10 folks.
10. And do you think there's there'd be support? Will this have any morale effects or?
I think, obviously, I think people would prefer for everybody,
Sure.
to receive it, of course. But I also think, our staff is clear-eyed in terms of understanding the broader fiscal environment that we're in. So I'm confident that would be manageable. We did note in the memo that our proposal for our proposed approach, which does kind of hold this for the senior leadership team, is based on a decision that the executive branch made last July. And so they may, in fact, revisit their approach this July as they're finalizing the state budget. And so we could consider this as sort of a holding on the COLA for senior leadership until there's updated information from kind of a contextual environment perspective with respect to the executive branch. So could be something we potentially return to mid-year if there's a shift in direction in the executive branch, but would very much welcome this group's input on that.
And just to confirm, Audrey, this is reflected in the budget that we just looked at.
That's correct.
So Audrey, by not giving the senior leadership team the 5,000, we save $50,000. Is that what you're saying?
That is
About.
fair, yeah, about that. Yeah, correct.
On a millions and millions of dollar administrative budget?
Yes.
As Matt Gorkowitz always reminds me, every program is only composed of $1,000 chunks.
Yep. I might have quoted him once in my own budget meeting, but I'll deny that.
Thank you, Secretary. That was a good reminder.
Yeah, I would say that having it aligned with executive branch makes my life easier in terms of, because as you may know, on the executive side, the decision was we honored all the raises that were our unionized and our at our sort of staff level, and then we held all raises for managers above a certain level.
Yeah, I can very much appreciate the politics and the consistency in the environment. So,
I am in favor of everyone receiving the bump, but certainly from looking at what's happening at the administrative level in terms of what the administration is doing, I think it would be somewhat not in alignment with the administration for this organization, this agency, not to follow suit in terms of what's happening as it relates to governors. We touch on the issue of a bonus, and again, I don't know, as you alluded to earlier, Audrey, whether or not we have gotten to the maturity level from the performance review perspective, where we can really look at a bonus and really peg that bonus to performance across the board for the agency, and giving where we are with regard to current financial performance and current budget. I'm not sure that would make a lot of sense from my perspective.
That's fair. We can certainly keep monitoring the situation, and I think our instincts about prioritizing an increasingly mature performance review process, obviously they have their own merits, and if circumstances allowed for us to incorporate some kind of a bonus or merit-based adjusting process, we'd have the system ready to go to do that. So we'll, I think, just continue on that that pathway with our performance review process, and then if the circumstances suggest we're in a position to be able to do that, then all the better.
When would this all be communicated?
Typically, once the subcommittee has, reached comfort, usually within, a week or so, I would be communicating it to staff, and we typically make it retroactive to the first of the year. But welcome any thoughts if there's any advice to the contrary on that approach.
No, I mean, as long as communication is we appreciate all employees, including our senior leaders, and
Yeah. Yes, we would take care around that for sure. Particularly this has been a very challenging year for the staff, and so we'll certainly go out of our way to make sure that that is not received as an indication of any, lowered confidence in any particular category of member of the team here, and really just linked to the connector. It's important to me and this organization that we're kind of team players and an alliance. Even though we are quasi, we are independent. We certainly want to make sure that our colleagues who are doing just as hard of work in the executive branch, that we're in solidarity with them.
yeah.
So
Would we be able to
we move-
revisit? Oh, sorry, Dimitri.
Yeah, sorry. We move ahead and let's say we move ahead and we do this, and everybody get their 5K minus senior leadership. Where will we be with regard to parity between our organization and HPC or any other quasi as it relates to functional role and compensation? Will we then be within parity with those other agencies, or will we still be behind? Is this an ongoing issue that we have to continue to look at?
Yeah, it's a great question. I don't know off the top of my head. We haven't been studying or looking particularly at our peer quasis specifically around. There's lots of different functions and types of roles in those organizations. We are putting into place a broader kind of market pay review that would include other types of government agencies and quasis. So I don't have that off the top of my head, but we are trying to pull that together. So, we're unique. We're not exactly like the rest of executive branch government. We're not exactly like the private sector. So those quasis as comparators is always very helpful. So happy to keep you posted as we get more information on that.
Audrey,
In terms of
we have no union employees, is that right?
That's correct.
Yeah, okay.
I guess, Audrey, I'm trying to, even if we were to step back and look at it in terms of industry as a whole, someone who's doing accounting in the Health Connector, if they step out and take a similar accounting job somewhere else, how far are we off in terms of where the market is in terms of both public and private marketplace and
Right.
where we are as an agency? So it would be very helpful, perhaps, if we can undertake an exercise to really try to really get a hold in terms of where we are with regard to other public organizations and where we are with regard to the public marketplace. Because from my perspective, I want to make sure that you continue to have the qualified resources that you need so that we can continue to do the work that needs to be done to ensure success at the connector. And that means having good people, and good people should be paid, relatively speaking, at market value.
Right. Thank you. I so appreciate that, Dimitri. And I do expect that in first or second quarter of this year, we will have much more information on that to be able to answer the exact question you just teed up.
Any other questions or comments? Dana, did you have something?
I did. I just wanted to ask, like, if at any point the executive branch unfreezes our manager raises, would we as a subcommittee be able to reevaluate that? Just if we're choosing to freeze them now to keep in line, I want to make sure we have that ability to go back as well.
Yeah, I think the answer is yes. This is not a required vote. Like I said, it's really a dialogue we want to have to ensure that the subcommittee feels comfortable with the direction we're going. So if that were to happen, Dana, I think, I would be in touch with the subcommittee, let folks know what had changed, and we could, put forth for the subcommittee's, comfort and consent if we wanted to recommend an update kind of mid-year based on circumstances changing.
Thank you.
Sure, thank you.
Great. Well, thanks, Audrey. I think
Thank you. Thank you all. Appreciate the support and the nuance. And unless any other questions, I will plan to proceed with that proposed direction and start communicating that with staff with the kind of care and nuance that we discussed. And I know for the last item I drop, so I will take my leave and do not plan to return, but Kathy can come find me if there's any reason I need to hop back on. But thank you all. Thank you, Bella, for chairing, and great to see everybody.
Thank you.
Thank you all.
So I think the last item on the agenda is to review the fiscal year 2025 financial audit.
Great, thank you. Nice to see everyone. Bob Mahoney, I'm the partner on the audit. And with me today is Lisa Pegliaro, who's a managing director with KPMG. So as Carrie mentioned, we did issue our opinion on the financial statements on October 31st. We also issued our Yellow Book report, or report on internal control of financial reporting, and there were no significant deficiencies or material weaknesses that we identified during the audit. And then we also issued our required communications letter, which includes all of the required communications to those charged with governance. Overall, the audit went very well this year. We received great cooperation from Carrie, Stacy, and the rest of the team, and they should really be commended for preparing the statements accurately and timely. And with that, I'll just turn it over to Lisa to go through some of the required communications as well verbally, even though they're also in the letter that we issued.
Hey, thanks, Bob. I actually did, I'm not sure if okay, it looks like I can present. I did put together a quick summary since it's probably been a bit since you would have seen the required communications letter. Yep, okay, it looks like we can see that. So the overall good news, like Bob mentioned, is we did issue an unmodified opinion, or a clean opinion. The other theme you'll see here in our required communications is that in general, we do not have any matters to report. So there were no difficulties that we encountered. In general, we were able to continue with our plan the way that we had set out to. The one item to comment on is that we did have a minor uncorrected audit misstatement that related to a correction of a previously existing non-GAAP policy. So not something we would expect to continue to see going forward. In general, it's overall immaterial to the financial statements. That was management's conclusion, and we concurred with that. Just to go to the next page here. This one is just a very good news. No matters to report. No concerns with related party transactions. No overall concerns with the entity's ability to continue as a going concern or any subsequent events that we had to consider. And then just another quick summary, we did not identify any actual or suspected fraud involving management or employees with significant internal control abilities. We also confirm as of today that our engagement team remains independent of the Health Connector. And then the last item that we have is just a memory jogger of required inquiries. Certainly do not need to go through all of these right now, but just a good reminder if there was anything that you are aware of or something that came up throughout the year that would impact our audit, especially the risk assessment of material misstatement or any concerns that you do have, that you should please feel welcome to bring that up to Bob or myself so that we can incorporate that into our audit plan. So overall, like Bob said, it was a very successful audit. Stacy and Carrie's team are fantastic to work with and very attentive to all of our requests, which we know is not always easy since they do also have a day job in addition to the audit. So I'm not sure if there are any questions for Bob or myself at this point, but that is our prepared remarks.
Any questions?
Did you have access to everyone you needed access to? Did anybody try to?
Yes.
Yes, full cooperation from management. No, there were no instances where there was any difficulties. Overall, the team is very willing to work with us and work through any questions that we have.
Any issues you think this committee should be focused on in the year ahead?
I mean, I think the big ticket item for the 26 audit will be the migration process that's starting, in April to the new vendor, which I know it doesn't technically go live until I think July 1 of 26, which would be fiscal 27. But I think that's an item that I know Carrie and Stacy have spent a lot of time with the current vendor. So I think, just making sure that goes smoothly, as smooth as it can, is, certainly something that we'll be discussing with them for 26 and going into 27.
And anything you think the board or this committee should pay particular attention to is in tracking that, warning signs, things to be concerned about?
No, nothing specific that I would bring to your attention. I mean, I think there's a lot of details that I think Carrie and Stacy have been working with the current vendor through. But I know they've been doing a lot of due diligence on the data to make sure that everything goes smoothly, but nothing that we would want to bring to your attention at this point.
Along Nancy's question, just to dovetail off that, any concerns on governance that you feel this subcommittee should be aware of?
No, I don't have any concerns.
Have we become a boring client with
No.
year after year?
No, this is only my second year as the lead partner on it, on the engagement, but
It's obviously always great news when you get a clean audit and no concerns, so.
Great. Any other questions or comments?
We'll see if you can do 3 in a row next year.
Right. Thank you, Lisa. Thank you, Bob.
thanks a lot.
Thank you.
Thank-
Take care.
So I think now I can entertain a motion to adjourn the meeting.
So moved.
Move second.
Great. Kathy, do you want to take roll?
I'd be happy to. Secretary Mahonio,
Yes.
Bella,
Yes.
Nancy,
Yes.
Dimitri,
Great.
Dana.
Motion passes.
Yes.
Oh, sorry.
thank you, everyone.
Thank you.
You called on us in a different order in this meeting.
Because there's only so many of you. I can do it.
You really threw me off. I know exactly my place usually, but
I don't have a list. It's just as you popped in, I wrote you down.
yeah. right, thank you, Kathy.
Thanks,
All right,
everyone.
thank you.
Stay
Bye.
warm.
Tosh.
Everyone.
Everyone.
Bye.